Hello, my name is Michael Ricker and I'm doing my head-to-toe assessment video. My patient here is JG. He's a 45-year-old Caucasian male. He came into the office well-groomed and wearing appropriate clothing for the season. I took his vital signs and measured his height and weight. His vital signs were stable. We performed the Snellen chart eye test, and his eyes with contact lenses of both eyes are 20/20. And I had him empty his bladder and put on a comfortable pair of shorts for the assessment. And when I walked into the when we assessed his walking, when we walked into the room, his gait was stable without any assistive devices. First thing I will check, it will be his head, his symmetry, the skin, make sure there's no nodules, no lesions, nothing else, and how his hair is is fully distributed throughout his head. And then I look at his face. His face here his skin is clear of lesions, acne, or any nodules or suspect nevi. I will palpate his facial bones for any tenderness and any masses. Do you ever feel any tenderness?
No.
Okay. Second, I'm going to palpate his temporal mandible joint. I'll have him open and close his mouth, and then go side to side with his jaw. There's no clicking, no popping or crepitus. Okay. Then I will check his palpate his sinuses, his frontal sinuses, and his maxillary sinuses, and also percuss them. Excellent. Do you feel any tenderness?
No.
I see no fullness, so the sinuses are doing well. I want to check his I have his cranial nerves number 5 and number 7, and I want to first have him squint his eyes real tight, and then wrinkle his forehead, okay, and then smile. And then clench his teeth real tight, okay, and then close his mouth and puff out his cheeks. And then I want him to stick out his tongue. Okay, that's good for our cranial numbers 5 and 7. And individually, number 5, cranial 5, I'll have him close his eyes, and I'll do the light skin touch, and I want him to tell you where, using the cotton swab, where he feels it.
Forehead. Forehead, cheek, cheek, chin.
Okay, that's good for the facial nerve, or the cranial nerves number 5. So next thing I will do is I will go to the eyes. The eyes are symmetrical. There's no ptosis indicated. Can you close your eyelids? His eyelashes grow out and away from his globe of his eyes. His eyebrows are evenly distributed and extend from the inner canulus to the outer canulus. I'm going to check the conjunctiva and the sclera using gloves first. I'll lower his lower eyelid, and his sclera is white, and his conjunctiva is pink and moist. Sclera is white and pink and moist. Okay, that's good. Then the next thing I'll do is I will do assessment of cranial nerve numbers 3, 4, and 6 by first doing the having him focus on my finger with his eyes only. Do not move your head. This will go through the 6 cardinal fields of gaze, and I'll watch your eyes move without your head movement. Okay, that's good. 6 cardinal fields of gaze are good, and the cranial nerves are working well. Now I need you to do a cover and uncover test. I want you to focus in on a spot on the wall, put your hand over your right eye, and I want to watch the accommodation of your other eye whenever you remove it. Okay, so take your hand away. Okay, good accommodation. Now focus on the same spot and do the opposite eye. Remove it. Is it good? And you have accommodation is very good, so that's good. The next one would be to check out your near vision, we're using a Rosenbaum chart. I want you to read by closing one eye and read the lowest number or the lowest or the smallest letter row that you can read.
9, 7, 4, 2, 5, 6.
Okay, that's 20/20 in that in the right eye. Now in the left eye and then the right eye.
9, 7, 4, 2, 5, 6.
Okay, that's 20/20 vision. So with Rosenbaum test, optic nerve is working well. Now I'll do the pupillary response. I'll do direct and consensual real quick. Pupillary response, consensual, direct and consensual. The pupils are reactive and equal to reactive to light. Okay. And then we go from that, then we go to the ears. The ears are, the skin around the ears are clear of any lesions or nodules. The auricles are flexible. The pinna of the ears are horizontally in line with the inner cannula of the eyes, respective eyes. And then what I want to do is I'm going to test the cranial nerve number 8 by doing the whisper test. The whisper test, I'll have him take this hand and cover the opposite side, and I'll whisper a word, and he'll have to repeat it.
Peter.
All right, Peter was the correct word. Now I go to the other side. I want you to close the other ear, and I will do the same thing on this side.
John.
John is the proper word, so that's good. You're hearing well in that ear too. Next thing of all, I will test your hearing by using a tuning fork, and what I'll do is do the Weber test. The Weber test, I'll strike it, put it on your head, and you can tell me whether it's unilaterally the same or bilaterally the same in each ear. Okay? Do you hear both ears the same?
Same in each ear.
Okay, that's good. Now I'll do the Rainey test, which I'll put this, strike the tuning fork, and put it on the mastoid process, and you'll hear. Tell me when you stop hearing it there. Then I'll put it in front of your ear, and you'll tell me when it stops, and we'll time it. We'll do the same thing for the other ear.
Okay.
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 Okay. Okay.
Okay. We finished the Rainey test, and it showed that that you have good air conduction is twice as long as bone conduction, and that's what I measured by the time that it took for you to stop hearing that. The next thing I will do is I will inspect your external ear canals and check for cerumen and also the tympanic membrane. In your right ear, I see a small amount of cerumen, and the tympanic membrane is translucent and pearly gray. And then I'll go over to the left ear, doing the same thing. I see a scant amount of cerumen, and the tympanic membrane is translucent and pearly gray. So that's real good. You have no problems with no inflammation or anything on your ears. Next thing I'll do is check your nose out. Your nose is symmetric. You have no deviate septum. I want you to check patency of your nose. So you take one finger and close one nostril and breathe through it only. Okay, you breathe nicely. Do the same thing to the other ear. Breathe nicely. So good, you have good patency of both nostrils. I'm going to check visually up in your nasal cavity. And I see on both sides that the mucosa is pink and moist. You have the proper amount of hair. And also I can see both inferior terminals. All right, good. That's real good. And the next thing I will be doing is I'll be checking out, inspecting or assessing your mouth and your nasal or your mouth pharynx, or your oral pharynx, I should say. And I'll be looking at your open your mouth, please. I will be looking at your lips, your gums, your soft palate, your hard palate, your tongue. Your uvula is midline. I can see your anterior posterior arches. I can see your tonsils that are not swollen. I can see your buccomucosa is pink and moist. Your teeth are all there. You have all your teeth. You have not lost any. They're all white, and they have some cavities that have been filled with previous things. Now, what I want you to do is we're going to test some cranial nerves again, and we're going to have you first stick out your tongue. This is cranial nerve number 12. Right, go up and down with your tongue, and then side to side. Okay, stop that, and then you go to cranial nerve number 9, number 10. I will have you say ah. And at that moment, the upper palate is going up, so the ah is doing well. The ah reflex, and then also I'm going to do the gag reflex. Okay, so now that's cranial nerve number 9 and number 10. So everything's working out with that. Everything is good. So next thing I will be doing is your neck, and I will be inspecting it to make sure it's smooth, and I can see there's no problems with your skin and all your tracheas and midline and other things like that. That's real good. Now what I want to do is I'm going to palpate the trachea, and then also palpate have you swallow and palpate the thyroid. Okay, I want you to turn that way a little bit. I want to see if you have jugular vein distension. You do not. Turn this way. Any jugular vein distension this way? No, you do not. I'm going to check your passive range of motion for left and right of your head. There, and then up and down. Okay, and then I want you to put with resistance. Try to turn your head. Try to turn your head. Try to raise your head. All right, good resistance. Now lower your head. Okay, good resistance. So now you have everything looks good with strength, and then you have. I want to auscultate the carotid arteries. No, first I'll palpate the carotid arteries to see if you have good pulse. That's good. Carotid arteries are both sides. Do not do it at the same time. Then I'll auscultate the carotid arteries, and then also the thyroid, checking for bruits or thrills. And then the thyroid, checking for any arterial sounds at all. Okay, no arterial sounds. Okay. Next thing I want you to do is I'm going to check cranial number 11, which is I need you to shrug your shoulders. Shrug your shoulders like this. Okay, to go down again, then with resistance. Okay, that's good. Good resistance. Now what I want you to do is I need to have you put your arms out. I want to check your arms, your upper extremities. Your hair and your skin are in good condition. The hair is distributed well. Same way on this side. You have good capillary refill. That's good. I want to check clubbing. So you put your fingers together, see if there's any clubbing. No, there's space between your fingernails. Looks good. I'm going to check your brachial pulses simultaneously, and then your radial pulses simultaneously. Good pulsations. And then I want you to test out your strength. So try to pull towards you. Okay, then raise your hand and push toward me. Good strength. All right. Then I want you to do, so we're done with that side, and I want you to go around, and I want you to turn to the side. And I'm going to bring some stuff over here, and so we can do an assessment over here. So I'm checking your chest, your anterior chest, which is your back, or your posterior chest, I should say. Make sure there's no problem with your skin, no skin issues, symmetric scapula, your shoulders are good, muscle tone is good. I want to make sure that you have good tractile fremitus, so I want you to say 99 every time I put your hands on there, okay?
Okay. 99, 99, 99.
Okay, I'm going to check and see if you have good expansion of your lungs. So when I put my hands down there, I want you to give a big, deep breath. Okay, my thumbnails went away, so you have good expansion of your back and your lungs, okay? Then you have, I want to, I checked everything, and I want to do a inspection or a palpation of your vertebral angle. And what I do is I'll quickly do a Murphy's punch to see if there's any tenderness, okay? Okay? Same on the same side on the other side. Did you feel any tenderness?
No
okay.
tenderness.
That was a negative Murphy's punch sign. So there's no tenderness around your kidney area. What I also want to do is I want to do diaphragmatic excursion. So what I want to do is I will have him inspire, and then I will percuss all the way down to where he goes from resonance to dullness on both sides, and then come back up there after he expires, and then go up from that line to determine the diaphragmatic excursion. So I want you to take a big deep breath and hold it. Okay. Okay, there's dullness right there. Now you can release it now. Now I'm going to do the same thing. I want you to inspire real quick, and then hold it. I'll do this is down the mid-scapular line. Okay, right there is the point where I hear dullness. So now I go from now I need to do is release all that air and hold it. So you expire and hold it. Okay, 1, 2, 3. Okay, go up from there from dullness to resonance again. Okay, got that side. Now you can breathe again. Now I want you to do the same thing again. I want you to have a couple deep breaths and then release all the air. Okay, hold it. Go from dullness to resonance. Okay, right there. Okay, diaphragm excursion. Now I measure the two spots where it should be between 3 to 5 centimeters. This one is 3.5 centimeters. This one is 4 centimeters. And it's a good diaphragmatic excursion, so that's good for what you have there. Okay. Now I need to do is I need to percuss your lung sounds of your anterior side of your back or your chest. So I'm gonna start percussing on all spots that need to be. Looking for resonance. Okay, I hear resonance in all my percussion, so it's good. Now the next thing I'll do is I will listen to your heart or your lung sounds by auscultating with the stethoscope, and each side I want you to give a deep breath, big deep breath. Okay. Okay, I'm going to do the lateral side, so could you raise your hands up like that? Side to side, I'll go laterally. Okay, very good. Your lung sounds are clear, free of crackles, rhonchi, or wheezing. Okay? Now what I need you to do is go and turn toward me. Okay, I'm checking your chest out and your hair distribution. Your skin is good without any problems with your skin. Your hair distribution is consistent with a male physique. What I need to check is your respirations. Your respirations are even and unlabored, so you have good respirations. So what I want to do is check for tactile fremitus. So one more time, I want you to say 99 when I put my two hands on your chest.
99. 99. 99.
Okay, good tactile fremitus. So what I need to do now is I'm going to percuss all the areas in your front lungs for the resonance. Okay. Right. Okay, I heard resonance in all of the areas when I percussed. Next thing I will do is I will listen and auscultate with the stethoscope. for the same sound, the same areas for resonant or for lung sounds. Okay, lung sounds are clear, free of bronchi, crackles, or wheezes. Okay, the next thing I want to do is I want to make sure, also inspect for any impulses by the the apex of the heart, and then anything else. Then I want to check, make sure, and listen to your heart sounds, which there's 5 heart sounds: the pulmonic, the aortic, the tricuspid, the herbs, and the point of maximum impulse. And there I'm trying to listen to the 2 heart sounds, and any more if there is. So in the second intercostal space on the right sternal border, right here, is the aortic area. And then this is the second sternal intercostal space of the left sternal border, which is your pulmonic. And then the third intercostal space, left sternal border, is the herbs point. And then the fourth intercostal space of the left sternal border is your tricuspid. And then the midclavicular line, the fifth intercostal space. Midclavicular line is your point of maximum impulse. Okay, I hear sounds S1 and S2 only, no murmurs, no S3 or 4. Very good. Now what I need you to do is to lay down. And at this point, we're going to go to assess the abdomen and other things. So first we'll check inspect the chest again, make sure, or the abdomen, so there's no contour is good, movement's good, you have no problems with in your skin yet still on this that I couldn't see earlier. Okay, the next thing I will do is I will auscultate the lungs, or all 4 quadrants for your vowel sounds. Okay, I hear vowel sounds in all 4 quadrants. Now I'm going to auscultate for any sounds, any venous hum or bruits from your aorta artery. Checking your renal arteries. And your venous or your iliac arteries. And then your femoral artery on both sides. There was no venous hum or bruits, so that's good. Next thing I will do is I will have, I want to percuss for the liver borders. So what I'll do is midclavicular line on the right side, I will go from tympani to dullnus. That'll be the lower liver border. Okay, marker right there. Then I'll go from the midclavicular line going down, and I'll listen for resonance to dullnus. Okay, I'll mark it where I hear dullness, and that should be the upper and lower liver borders, and I should measure. That border should be anywhere between 6 and 12 centimeters. His is 8.5 centimeters, which is really good, so it shows that he has a healthy liver. The next thing I'll do is I will palpate or percuss the splenic area, and what I should find out, it should be between the 6th and 9th rib. So first I'll go mid-axillary area and percuss from tympani to dullnus. Okay, found right there. And then I go from resonance down to dullnus again. Okay, there you go. And it should be between that area, it should be between the 6th and 9th rib, which it is. So therefore, it shows that he does not have splenomegaly, which is good. Now what I need to do is I'm going to I'm going to do some light palpations on his abdomen, about 1 centimeter down. Check for tenderness or masses. Do you feel any tenderness?
No.
Any more tenderness at all?
No.
Okay, I didn't feel any masses. That's good. Now I'll do some deep palpations to check first his lower liver border. So what I'll do is I'll just make sure that I go right underneath the rib area and check if I can feel the liver in the case where it needs to go down as far as I can. I can feel the lower liver border right there, right at the rib cage area, at the lower rib cage area. Now, if a regular healthy human being, you wouldn't be able to normally palpate the spleen, but we'll try and see if he has any splenomegaly, which we didn't find earlier. Okay, there was no, I don't feel any the spleen at all, so he does not have splenomegaly, at least as far as our assessment is going. So now what I'll do is I'll assess the kidneys, which I need him to do is take a big deep breath, and I'll deeply palpate down there and let him exhale out, and I can feel the kidney go between my hands whenever he exhaled. On the right side, I'll do the same thing to the left side. I'll have him deep breath, and then exhale. All right, I can feel the kidney going through there, and I'll palpate the aorta to make sure I feel any pulsations. And I do not. Okay, so the next thing I will do is I will inspect his lower extremities. His lower extremities have good muscle tone. Hair distribution is equal and equal to for a man. What I need to do is I'm going to palpate his popliteal arteries. And I feel them right there. And then I do both dorsalis pedis or dorsalis pedis arteries, dorsalis pedis, I should say, and then the posterior tibial pulses. Okay. Then I'll check for strength in both legs. First, I'll have him flex the air, and then extend the leg. His knee, okay, good strength there. You go to the right side, try to flex it, extend it, okay, that's good. Now his feet, I'll have him plantar flex, okay, and then his dorsal flex. Dorsalis pedis was the actual word for what I was trying to do earlier. Then plantar flex, dorsalis pedis, or flex, okay, that's good. Then I need him to sit up for me. I'm going to check his reflexes first. All right. More time here. Okay. Then I do his patellar tendon, and then do all his Achilles heel. Okay. What I need to do real quick here is also to palpate his lymph nodes. His occipital lymph nodes are back here. His post-auricle, his pre-auricle, his submandibular, his submental, his tonsillar, his superficial cervical, his posterior cervical, his deep cervical. Can I have you check the supraclavicular? Okay, then I'll raise your head, raise your arm overhead, check for inferior clavicular, his axillary, his inferior, and his axillary. Okay, and that's all I need. So you can stand up for me, turn to there, bend over, check his spine. Spine is good, in line, and you turn back towards me. Thank you very much for your help and this assessment. Appreciate it. That's the end of the assessment.